This virus uses nursing homes. They are ground zero. They're the vulnerable population in the vulnerable location.
I think certainly the communication with the state health department related to nursing homes has been problematic.
Good evening. Families with loved ones in nursing homes know the last 3 months have been torture. And for all the regulations and measures that are in place, we simply don't know how many nursing home residents died of coronavirus. Not in central New York, not in New York State, nowhere. In fact, tracking the impact of this virus on our most vulnerable loved ones is a guessing game. Investigative reporter Mary Kielar is working for you tonight.
Kay House's family asked us to be there for her burial. She died after becoming infected with COVID-19. She lived here in the village of Chittenango at the Grand Rehabilitation and Nursing Home. Her family shared their heartbreak with me after they say they were told she passed away by a funeral home and not the Grand.
Got a call in the morning saying that she had tested positive for COVID, and then, but she didn't show any signs and symptoms. They were going to isolate her. And then this was around 9 o'clock, a little before, a little after, I don't know. And then I got a call from the funeral home at 12:41 asking me what I wanted done with her body, and I figured there was a mistake.
The State Department of Health lists just one death associated with this 80-bed facility, but they're not saying it's House's. A Madison County spokeswoman confirmed that of the 16 COVID deaths countywide, 10 are now tied to the Grand. So why the two different numbers? The State Health Department only reports those residents who died at a nursing home, according to Madison County leaders, not those who were sick enough to go to a hospital and passed away there. I asked why, and a spokesperson from the State Health Department says their data, quote, currently does not include out-of-facility deaths in order to maintain consistency and reliability in the data as presented and to avoid any potential for double counting. It's a troubling trend that nursing home and elder abuse attorney John Daly says he's seeing all over New York State.
There are going to be residents who were positive, who died, who were transferred out, that there'll be no records for or no accurate records for. So again, we're going to see an incorrect total.
Daly says he's heard from heartbroken families who have loved ones inside of the Grand in Chittenango and Rome. The Grand in Rome is where 9 residents died from COVID. State data shows 7 more deaths are suspected to be from COVID.
I've spoken to families who were lied to about the number of COVID positive residents in those facilities when they inquired.
The Grand tells me that there were no violations found when a crew from the State Department of Health came in unannounced on May 27th and May 28th. And they've maintained that they've had 2 separate units to keep infected residents away from the healthy ones. The vice president of the Grand tells me they've now turned over information about any resident who has tested positive for coronavirus and has since passed away, no matter what the cause of death on the death certificate states. A county spokeswoman reports the number of deaths linked to the Grand jumped from 4 to 10 over the last week as a result of that review. And yet the State Health Department continues to report just 1 death. John Daly calls this a New York problem.
Folks in Arizona, I've spoken to folks in Washington State, California. In the case of Arizona, they've been reporting deaths from the get-go, from the end of March. So I think we're a little bit behind the curve in terms of the reporting requirements from nursing homes.
Kay House's family says they're worried for anyone who has a loved one in a home and continue to call for more transparency from the state and the Grand as they mourn their unexpected loss.
Maybe we can help somebody else by giving our story, you know?
The State Health Department says their response is evolving, just like this virus. Working for you, I'm Mary Kielar reporting.